Here, I took my headset off because apparently I was the cause of the previous, my headset was causing the previous buzz. Hopefully this is better.
We're not judging though, don't worry.
All right, I appreciate it. And I do appreciate this hearing being held today. In recent months, we've seen a variety of efforts by the state, local, and federal government to educate and inform the public about vaccines. We've also seen efforts by the private sector, such as public service announcements from our cable providers and other TV and radio providers, and website tools that seek to bring awareness. It's important that we continue to find creative ways to communicate this information, as there are still many pockets of unvaccinated individuals. And Dr. Shelton, I was wondering if I could speak with you about that. You mentioned the proximity of the states and that are near us, and the committee has heard me talk about that many times, how you could actually be in 5 states in a single day down in our corner of Southwest Virginia. That being said, you're getting the information from the states, but I read an article, or you're hoping to get that information from the states, you haven't yet. I also read an article last week that the federal government was starting to share that information with localities. And I was just wondering if the VA was sharing that information, because both Mountain Home there in Johnson City and the VA center in Salem have vaccinated a lot of 9th District constituents. And I'm just wondering if that's showing up in your records of people in our district that have been vaccinated.
No, sir, not yet. We don't have the federal doses calculated. And in one instance, when we did talk with one of the local penitentiaries about the number of vaccines given, it actually raised our percentage 0.3 points in that county, but that was data that we did not have access to fully at this time.
And that was that the Grayson facility or the Lee facility? Was it federal or state?
Federal facility.
Federal facility, okay.
In Lee. Mm-hmm.
Yes, ma'am. And you've talked somewhat about it, but I know you're learning about the pockets of unvaccinated people, and I'm glad to hear you have mobile units out there. Do we need to do more to get the mobile units out, and maybe not just units that do the vaccinations, but as you indicated, educate the public about the history of the vaccines and the safeness of them? Are there other things that we should be doing or encouraging Virginia to do in that regard?
Well, we have a messaging campaign, and we are looking to kind of adapt this messaging more toward our localities and things that speak to them. As Dr. Omer said, message about liberty and freedom along a lot of our constituents who may not be wanting to get vaccinated, but also to answer their questions. A lot of people have concerns. The concern about fertility is huge in our area, and there are other areas where some of this more distinct cultural rural area messaging would be very helpful. Also, we do have health educators that we're beginning to send out in advance of our mobile units and to have a professional to be able to answer these questions one-on-one. And so more education of the health workers and how to really combat some of the questions they may see, and to be the boots in the ground and to answer these questions to get them a little bit better trained, and more people out doing this is very possible.
And I appreciate that. And I also appreciated in your comments that you talked about not labeling people or pressuring them, because the people in our area are very proud people, and you want to turn folks off, come in and say, we're from Richmond or we're from Northern Virginia and we're going to tell you how to do it. That doesn't work in our area, as you know, and I appreciated you making those comments. Do you want to amplify that at all?
Well, the health department in Southwest Virginia provides a lot of services for our community, and we are a trusted source of information to them. So we do respect all the viewpoints that we do here, and we try to work with people in their own community and to address their concerns specifically, again, while not labeling them, but giving them time. They haven't, people without a lot of internet access or other opportunities may not have had all the questions answered yet.
Yeah, I appreciate that. And I think it's very helpful that you're a native of the area and have long served both patients and the community. And I think that helps you get that message out. If there's anything that we can do to help get that message out, not only in our part of Southwest Virginia, but in East Tennessee or rural parts of North Carolina or West Virginia, all of which border our territory, and we're more than happy to do it. And as you can see, as the chairwoman pointed out, this is not a Democrat or Republican issue. This is about all of us working together. And we've had some counties that have been hit pretty hard, even over the border in West Virginia. I had a county over there, not in my district, but one that was really hit pretty hard. So we're trying to do it, and we appreciate what you're trying to do and what all the witnesses are doing here today. Thank you. I yield back.
Thank you, sir.
I think the chair now recognizes the chair of the full